everyone. Welcome to another episode of Bugs, Drugs, and Genomes. And this is Zephy, and I'm joined by Beverly and Pernille, and we're so glad to be back for another episode of the podcast as we dive into another fascinating aspect of AMR, global health, and capacity strengthening. Today, we're focusing on best practices in global health and capacity strengthening at the grassroots level. We're joined by Dr. Beverly from the Noguchi Memorial Institute for Medical Research in Ghana, who works to tackle AMR through research, surveillance, and capacity building initiatives across the African continent. Beverly will share how responsible research, local leadership, and ethical data practices come together in real-world surveillance. Today, we have a guest host, Pernille, a member of the Global Capacity Building Research Group who works as a project manager on our Seek Africa project. Thank you for joining us, Beverly and Pernille.
Thank you, Zephy. It's great to be here as a guest host, and I'm very excited to talk to you, Beverly. So to start us off, could you tell us a bit about your role at Noguchi and your work with AMR surveillance?
Thank you so much, Pernille and Zephy. Thank you very much for having me on the podcast. My name is Beverly Egyir, an associate professor with the Bacteriology department here in Noguchi Memorial Institute for Medical Research, University of Ghana. I lead the antimicrobial resistance hub and also coordinate the Fleming-funded SEC Africa project activities here in Ghana.
Thank you, Beverly. So you have a lot going on, but we would really like for you to tell us a little bit about the pilot site surveillance project that you started in Ghana.
So we started the national pilots projects, and here we have isolates within the GLASS or WHO GLASS priority bracket recovered from routine examinations from 13 hospitals or laboratories across Ghana. And these isolates are sent to us here in Noguchi. And when we receive the isolates, we confirm the identity of the isolates. We extract DNA and prepare libraries and perform sequencing. So in a nutshell, that is what we've been doing under the national pilots activities here in Ghana.
That's fantastic. Thank you, Beverly. That's great to have so many hospitals and laboratories joining in this surveillance project. And with all the data that you create, I can imagine that it's important to share the results. So how have you shared the results of this surveillance project with the hospitals that you have who have been working with you in this pilot project? And why was it important for you to do this?
So over the years, under the national pilot projects, working with the several hospitals that have indicated, we've generated large data sets and we normally analyze the data generated. And then once we've analyzed the site-specific data, we share it with the respective sentinel sites so that the hospitals will get to know, for example, the antimicrobial resistant genes, virulence genes, or high-risk clones that are circulating in the respective hospitals. And in this data, the hospitals also get to know whether there are outbreaks that are going on undetected. And this data is very useful because it informs antimicrobial stewardship programs as well as infection prevention and control programs in the hospitals. And we've not only shared the data with the Sentinel sites, but we've also gone ahead to share the data with the national AMR platform with the objective of shaping surveillance efforts as well as AMR policy. And it's very, very important to share this data because data shared save lives.
Thank you, Beverly. That's a very powerful message that sharing data saves lives. And I'm convinced that what you have done over the years definitely has contributed to this. And building capacity requires a lot of effort. So what kind of support or capacity building, in your opinion, have made the biggest difference for sustaining AMR surveillance in Ghana?
So from my observations over the years, capacity building has really stood out for me, or specifically workforce expansion. I remember before SEC Africa activities, we had very few staff who can actually prepare libraries, perform sequencing, as well as bioinformatics analysis. Now, under the SEC Africa project, we've been able to train more staff who are able to do these laboratory processes. So, for example, library prep, sequencing, and bioinformatics analysis. And in addition to training our own staff, we've also supported several students, laboratory staff, and scientists, and not just in Ghana, but in several African countries. And these activities or trainings have contributed to workforce expansions, which will sustain AMR surveillance or activities. In addition, the investment in having the NESIC 1000 sequencing platform has also contributed to expanding our outputs in terms of the sequences that we have done or the genomes that we have sequenced. And this has contributed to the generation of what I'll say the largest local genomic data in Ghana. And we are very, very happy to be on this journey with the SEC Africa project.
That's amazing. You've accomplished so much, but there are also some challenges in the current climate. So what would you say are the challenges of balancing global data standards with local realities and laboratory capacity and clinical workflows such as your setting?
So indeed, we've come a long way when it comes to strengthening AMR surveillance systems. All the same, there is more room for improvement, especially in our settings and other LMIC settings. So, for example, the challenge of access to internet. Several, areas in our settings have limited access to internet. And therefore, this is it becomes difficult when data analysis is being done. When, for example, genomes will have to be downloaded or uploaded. The other challenge is the few workforce that we have. You need the individuals, the workforce, the staff, the trained staff to be able to sustain AMR activities. We still have a few workforce and teams with limited skills. So the challenge of having fewer skilled workforce can also impact how often data is generated and how AMR surveillance is sustained in several LMIC settings.
Yeah, thank you, Beverly, for highlighting some of those maybe things that you think in day-to-day life are given, that you have proper internet, but that can actually be a challenge when you're working in a resource-limited setting, that you have these small things that make sometimes a big impact on the progress. So for early career researchers and practitioners working in global health, with your extensive experience, Beverly, what advice would you give on conducting research that is both rigorous and equitable?
What I'll say is that, it's important to follow standard laboratory processes to enable or to support the generation of data that is comparable to international standards. Because there's a saying that garbage in, garbage out. So it's important to generate data that will correctly inform the needed directions that we need to go in line with AMR surveillance, etc.
Thank you so much, Beverly. Some excellent points there as well on keeping good standard on data. And I think that's underpins the importance of doing local worker training and doing workforce expansion and upskilling of your staff in the laboratories on the continent. So thank you so much, Beverly, for joining us today. And thank you to everyone at home for listening. That wraps up our episode on global health and capacity strengthening. But before we go, we have a quick quiz for our listeners.
Okay, so our quiz question is, how can we strengthen global collaboration to tackle AMR? And the options are, option A, collect local data and collaborate on a national and an international level. Option B, discuss internally about issues in AMR within a laboratory. Option C, keep data archived until necessary. And the right answer is option A, collect local data and collaborate on a national and international level. Thank you so much for tuning in to another episode of Bugs, Drugs, and Genomes. Stay tuned for our upcoming episodes where we continue to delve into our research group's work, AMR in policy and practice, and interesting career insights. Don't miss it. We'll see you next time.